Medicare Part A and B premiums are not included with the plan but can be added at any time during the year. You will pay a monthly premium to cover this part of your healthcare costs. The amount that you pay depends on which plan you choose. Medicare Advantage plans, sometimes called Part C, or MA plans, are offered by private companies approved by Medicare. If you join a Medicare Advantage plan, you still have Medicare. The page includes information about covered services, rules, and costs for Medicare Advantage plans. It also includes information about drug coverage in Medicare Advantage plans and how Medigap plans work with Medicare Advantage plans. Covered services in Medicare Advantage plans. The following is an overview of the types of healthcare services that may be included as part of your plan benefits. Hospitalization. You can stay at most hospitals if they meet certain requirements. Your doctor must approve hospital stays longer than 3 days. Some plans cover outpatient surgery, but not all. Physician services. Doctors who accept assignments from your plan will provide medical treatment to you when needed. They usually charge lower fees than doctors outside your network. Rules for Medicare Advantage plans. Medicare Advantage plans are a type of healthcare coverage that provides an alternative to traditional Medicare. These plans are offered by private insurance companies that are approved by Medicare. And they provide the same benefits as traditional Medicare, along with additional benefits that are not covered by traditional Medicare. If you are enrolled in a Medicare Advantage plan, it is important to understand the rules that govern these plans. Here are some of the most important rules that you should be aware of. Enrollment periods. You can enroll in a Medicare Advantage plan during the Annual Enrollment Period, AEP, which runs from October 15th to December 7th every year. You can also enroll during the Initial Enrollment Period, IEP, when you turn 65 or when you become eligible for Medicare. Additionally, there are Special Enrollment Periods, SEPs, that may be available to you if you experience certain life events, such as moving or losing your existing coverage. Network restrictions. Most Medicare Advantage plans have network restrictions, which means that you will need to see healthcare providers that are in your plan's network in order to receive the full benefits of your coverage. If you receive care from a provider that is outside of your plan's network, you may be responsible for paying all or part of the cost of your care. Cost sharing. Medicare Advantage plans typically require you to pay certain out-of-pocket costs, such as deductibles, copayments, and coinsurance. These costs can vary depending on the plan that you choose. So it is important to review the plan's summary of benefits and coverage to understand your costs. Prior authorization. Some Medicare Advantage plans require you to obtain prior authorization before you can receive certain medical services or treatments. This means that you will need to get approval from your plan before you can receive care. And failure to obtain prior authorization could result in your plan denying coverage for the service or treatment. Coverage rules. Medicare Advantage plans must provide coverage that is at least as good as traditional Medicare. But they may have different rules for coverage. For example, some plans may require a referral from your primary care physician before you can see a specialist, while others may not have this requirement. It is important to review the plan's summary of benefits and coverage to understand the rules for coverage. Prescription drug coverage. Many Medicare Advantage plans include prescription drug coverage, but the rules for this coverage can vary depending on the plan. Some plans may require you to use specific pharmacies or may have a different formulary of covered drugs than traditional Medicare. It is important to review the plan's summary of benefits and coverage to understand the rules for prescription drug coverage. All-in-one coverage options is right for you? Let Chris Antrim Insurance help you. Many Medicare Advantage plans combine both Parts A and B into one package. This means fewer out-of-pocket expenses because you only pay deductibles and copayments once per year instead of twice. You can choose from an all-in-one option which includes hospitalization, skilled nursing facility, home health care, durable medical equipment, outpatient therapy, vision, hearing aids, and much more. Choosing Chris Antrim Insurance for your Medicare Advantage plan can provide you with comprehensive coverage. Affordability, access to a network of healthcare providers, prescription drug coverage, personalized care, innovative technology, and high-quality ratings. We believe in offering our members the best possible healthcare coverage and are committed to helping them live healthy, fulfilling lives.